So the KEYNOTE-189 is a phase 3 trial, and it is a very important trial because it is the first trial who demonstrated that the addition of immunotherapy to chemotherapy can work, and we have a decrease of the risk of death of about 50%. This was a phase 3 randomized trial. It was randomized Cisplatin Pemetrexed versus Cisplatin Pemetrexed with Pembrolizumab, given at the standard dose. The randomization was a 2-to-1 versus placebo, and the final results of the trial were presented in the New England Journal of Medicine about 2 months ago, suggesting at the interim analysis that there was a decrease of the risk of of the risk of death of 50% and the decrease of the risk of progression of 50%. So the trial was interrupted for the interim analysis, and the patient-reported outcomes are an ancillary part of the trial, a secondary endpoint of the trials, presented here in ASCO, and they are a poster discussion. The patient-reported outcomes suggest that there is a benefit in terms of patient-reported outcomes, and that chemotherapy plus pembrolizumab, also if it is a triplet and not a doublet, they do not worsen the patient-reported outcomes, but we have a clear benefit at week 12 and 21 of improvement of symptoms in this kind of patients.